You are about to view the procedure for bleeding time determination. The bleeding time test detects platelet function disorders by testing platelet plug formation in the capillaries. It is used in diagnosing problems with hemostasis and as a pre-surgical screening test.
When was the last time you had aspirin or any similar medicines?
I think it's been about a month.
Okay, and this test might leave a little bit of a scar right about there. Is that okay?
It's okay.
Determine whether the patient has taken aspirin or any other salicylate-containing drug within the last 2 weeks. Advise the patient of the potential for scarring. Select an area on the inner volar surface of the forearm, distal to the antecubital area, and devoid of surface veins, scars, or bruises. The lateral aspect is preferred because using the medial aspect tends to cause more pain and has a higher incidence of scarring. It may be necessary to shave the test area lightly if it is covered with a large amount of hair. Be careful not to touch or rest the blade slot of the puncture device on any unsterile surface. Inflate the blood pressure cuff to 40 millimeters of mercury. The time between inflation of the blood pressure cuff and making the incision should be between 30 and 60 seconds. This pressure must be maintained throughout the entire procedure. Remove the safety clip and place the puncture device firmly on the forearm without pressing. A horizontal incision parallel to the antecubital crease is recommended. Depress the trigger while simultaneously starting the timer. Remove the device from the arm as soon as the blade has retracted, approximately 1 second after the device has been triggered. Blot the blood flow at 30 seconds by bringing the filter paper close to the incision and absorbing or wicking the blood onto the filter paper without touching the wound. Touching the wound will disturb platelet plug formation. Continue to blot every 30 seconds until blood no longer stains the filter paper. Stop the timer and record the time to the nearest 30 seconds. Remove the blood pressure cuff, clean the arm, and apply a butterfly bandage or steri-strip. Cover with an adhesive bandage. Instruct the patient not to remove either bandage for 24 hours. The normal duration of this test is approximately 2 to 8 minutes, depending on the method used.
Okay, now just don't get this wet and just leave it on for about 24 hours.